Hi everyone! The first thing you will notice if you aren't new to this channel is that I no longer have an NG tube. My operation went ahead. I am currently 17 days post-op, and this video is going to be a discussion of how things went down and my feelings since. So I had 2 surgeries at once. It took a long time to organise because of this. So I had an ileostomy and a jejunostomy. An ileostomy is a bag which redirects your bowel contents and bypasses your large bowel. And a jejunostomy is a feeding tube which is inserted higher up in the bowel. And I get all my calories through the jejunostomy. So that's quite complicated. I now have 3 stomas in all. So I have a gastrostomy, which is venting, so it gets rid of my stomach contents because I have a condition called gastroparesis and my stomach contents don't empty. So yeah, I've got a lot going on in my stomach area. So I thought it'd be really interesting to discuss my perspective on everything that has happened. So if you watched the last video, you may be aware that I wasn't too confident that this operation was going to go ahead. It wasn't a pessimistic thing, it was more of a managing expectations thing, because I have travelled down, my hospital is about 2 hours away before to the hospital, and I got there at like 7 AM having set off at 4 AM, and they've said no beds, we can't operate on you. So we turned up, we were there for 7 on the dot, and they let me in, they checked me in. They didn't let my mum sit with me beforehand, usually they would, but because of everything COVID, yeah, so I was in alone. I get there, I get changed, I'm like sitting there thinking, oh well, it's 7 o'clock now, I'll probably be last on the list knowing my luck, so that'll be 12 and then I'll be operated on for an hour or 2, and then, but actually I was first on the list, so I was really fortunate that I didn't have to spend a lot of time waiting around. So I had 2 surgeons come and discuss risks with me to consent me for the procedure. Since the last time I've had surgery, I've had quite a few diagnoses, and this meant that the conversations we were having were quite a bit more serious. So we had the mortality talk, so the surgeon said, in someone with your conditions, this surgery has a 2 to 4% mortality rate, and obviously they discussed the risks of infection, bowel perforation, blah 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 blah. But strangely, I was I didn't let it affect me. Like, obviously I understood what they were saying and the impact of going ahead with this surgery, but I think I have been in so much pain for so long, I don't see another way of continuing living, because I felt like I had no choice essentially, because yeah, it's been a really tough year, 18 months, 2 years while I've been waiting for these surgeries because of the amount of pain I've been in. So I go down to theatre, it's 9 o'clock, and the anaesthetist is there, so they've consented me also, but because of my newly diagnosed conditions, I'm an increased anaesthetic risk. So they place something called an ART line, or an arterial line, and because I've got tiny hands they really struggled to get an ART line in. Fortunately I can put up with quite a lot when people are trying to get lines in and things. I've had arterial lines before in a ward setting, in a medical setting. So they tried 13 times in this arm, weren't successful, so they decided to put me to sleep and then put an arterial line in. An arterial line is something that's really clever. So essentially it measures your temperature, your blood pressure, your pulse, just like, it looks like a cannula. So they tell me that I am going to have a special kind of intubation because I have reflux issues. So they put pressure on my throat as I was going to sleep, and I have had that done before, so I really didn't stress about it too much. They also said they were using a kind of anaesthetic without muscle relaxant, so because I've got a condition that affects my muscles, they worry about that. So I was telling myself to be really relaxed as I was going to sleep. So I was like really loose. And yeah, another thing from an anaesthetic point of view was that extubation. So that is when they're taking the tube that breathes for you during surgery out. They said I'd have to be awake for that happening so they could make sure that everything was okay, and I don't remember that happening, so they must have given me something like ketamine that makes you forget. Yeah, anyway, so back to the surgery. So instead of being put to sleep in the anaesthetic like small room, because of COVID, everyone in the hospital I go to is being put to sleep in the main theatre, and I think that would freak a lot of people out, but I actually found it really interesting. They had really in-depth monitors, and I've never seen a theatre before, so rather than freaking me out, it actually made me feel a little bit calmer. I know that sounds ridiculous, but I think it was because I could see they had all the best equipment. They had top of the range facilities that I felt that little bit safer. So yeah, I was put to sleep and both operations happened. I don't remember being transferred from the like recovery to the ward, but I do remember the anaesthetist scowling. That's the only memory I have of waking up. I don't remember anything other than that. So I was on a surgical high dependency unit, and I wasn't too sure where I was. Because of COVID, everything has moved, and we were in a really random part of the hospital, so I couldn't put head and tail together to work out like what was going on. But I've since found out I was in HDU, and the care there was brilliant. I woke up with the art line still in. I had it for the next 3 days, and I had a PCA. So a PCA is a patient controlled analgesic, which is essentially just pain relief that goes straight into your veins. You have a little button. I took a picture of the button, and I'll insert that here. It's you can press it, and a controlled amount of a drug is directly delivered to your veins. I was initially put on morphine, but morphine, it just made me sick. I was throwing up everywhere. It was not the best situation. So I was then moved on to fentanyl, which was a lot better from a feeling woozy perspective, so it didn't make me feel as sleepy, and also from a sickness point of view, I was a lot better on the fentanyl. The first memory I really have of HDU is pulling up my gown and looking and seeing if they had managed to do my surgery, because it wasn't an internal thing, it was two very external things they were putting into my body. So I saw that I had a bag, and I saw that I had a second tube, so I was so thrilled. Before any doctor had come and spoken to me, I had known that those things had happened, that the goal had been achieved. and that was a big relief. You wake up from surgery with a clear ileostomy bag on, so you can see the stoma and the output that it's producing. Again, I think if I hadn't done my research, this would have really freaked me out, but I am quite well versed in stomas and medical things, so it didn't throw me at all, really. I was expected to have something called a paralytic ileus, which is essentially the stoma not working because of all my other conditions, but I was very fortunate in that my stoma started working pretty quickly, and I think that's because the areas of my bowel that I have the main issues with is my esophagus, my stomach, and my large bowel. So my small bowel so far hasn't been too badly affected by my overall condition. So I responded really well to the bag. So I had the PCA, the analgesic, for the next 2, 3, 4 days, I can't really remember, and I'm a bit of a keen bean, so I asked for that to be taken out pretty early on, and that was a bit of a mistake. I think I was still in quite a lot of pain, and I should have just taken it. Like, I don't know what it is with me, I'm not very good at going, yep, I'm super ill and give me the medicine and I will just lie here and recover. I'm always wanting to like jump the gun and be on the next step. So yeah, they took the PCA out a day or two too early, really. Then I was moved from the high dependency unit to a surgical ward, but I was not in the ward itself. I had a side room because I am shielding and I have other immune problems going on. All of the wards I was on were green wards. Now, green wards are wards where every single patient has been tested for COVID 3 days before their surgery, and all patients have been advised to shield 2 weeks before. I was in as safe a situation in hospital as I could have been. All staff were wearing PPE at all times, masks and shields, so I did feel protected, and that was a relief. So the PCA has come out, and obviously I'm in quite a bit of pain. So I am normally on a small amount of opiates to control my everyday pain, dislocations, etc. And obviously I had all of that still going on, but I'd also had this big surgery. So because I have a chronic pain condition, the surgeon said, this isn't our domain, we're going to have to refer you to the chronic pain team. And the pain relief wasn't really cutting it, so I was all for that. I was like, yep, get them to assess me and we'll have another conversation. The pain team came and it was just, I was railroaded. They didn't want to help me at all. In fact, they wanted me to come off opiates altogether. No, never mind reducing my dose or increasing my dose because I was in so much pain there and then. I was a week post-op. They wanted me off them altogether. So I managed to have a conversation with the consultant and I said, come on, this is not fair. I have chronic pain issues anyway, and you're looking to halve the amount of pain relief I'm on right now. We've only just got on top of the pain that I'm in. This is not fair. And I kid you not, the consultant said, people who just deal with pain have better outcomes. Wow. And he also said that doctors are your worst enemy because they will want to prescribe something and help you, but they're actually hindering you. Now, I get that to a point. I get completely what he was saying. Opiates aren't a great thing for your body, but I was a week post-op and it was just the wrong time to have that conversation. Not only that, but he said, I'm writing to your GP and saying you can't be on opiates anymore. When I asked about the reasoning for this, he said, well, I think you're at increased risk for osteoporosis, which isn't something that I am at increased risk of. Yes, I can't be physically active, but I have done a lot of research and I can't really find anything to suggest that opiates massively increase your risk of getting osteoporosis. And in the situations that people have been at increased risk, it's because they've been on extremely high doses for a number of years. And that was not the conversation we were having. We were talking about post-op pain, and that really, it crushed my faith really it tainted my whole stay, really. Everything was so good, the wards were so good, the staff were amazing. It was just the pain team and the fact that because I have chronic pain, it's like, well, you should just get on with it, like what's the problem? And they also cited constipation as a concern. Now, I was having the opposite problem. My stoma output was just like water, and when I tried to point this out, he didn't want to hear it. So I was absolutely gutted. I ended up phoning my mum and crying on the phone with her and saying, you know, I'm not gonna be able to sleep because they're so obsessed with opiates and my overall opiate use, which is low anyway, that in a post-op setting they're withdrawing quite a significant amount of care. And I ended up phoning a unit that looks after me on the palliative care side of things, which is obviously in a different CCG, but they were really helpful. They ended up phoning the pain team, and they put my pain relief up a teeny tiny bit, but they were pretty firm and there was nothing that anyone could do about it. No one could overrule them in that CCG. So I was really stuck, and I think it was really awful for someone to tell me that, like, I wasn't strong enough, and if I just willed myself out of it, I would do better. I felt like it was really out of line, and that it was a pretty disgusting consultation, considering the amount of stitches I'd had, and yeah, it was major surgery. So my high output stoma was just being an absolute nightmare. Instead of producing stool, it was just producing water, and I wasn't absorbing any feed. It was impossible to change the bag. It would take like 20 minutes because it was just spurting everywhere. So I was put on a medication which slows your motility. I still wasn't tolerating my feed. It was thicker, but I still wasn't tolerating it. So that CCG doesn't have a contract with my feed company, so my mum had to travel and bring the feed in. Obviously because of COVID there were no visitors, so I managed to convince the ward sister that could I just see my mum from a distance and wearing masks and just say hi, because she was travelling for 2 hours there, 2 hours back, just to drop off some feed, and that actually happened, so that was amazing. It was really, really lovely to see her and to have a bit of a catch up, although at a distance. I think in some ways not having visitors helped me to detach from home. I think when you have visitors, it can feel like an emotional wrench as they're leaving. Whereas not having visitors, although it was quite lonely, and we did FaceTime, it was kind of, it allowed me to separate myself, which was a positive thing. So I've never really tolerated feed, ever. It's never been something that I've been able to have during the day and function. So during the day I am on water just because I get very, very bloated, nauseous, I'm in a lot of pain, my pulse spikes, a lot of issues, and even on my normal feed this was happening. I wasn't absorbing very well, and the dietitian came in and said, have you ever had allergy testing? And I said, well, no. Do you think that's something I should have? And he said, I think that would be a really good option. It's possible that you have a dairy intolerance, so I am going to be having extensive testing around feed, just to see if we can improve that portion of my life. That's been something that I've always just accepted and got on with. I just thought it was normal, but actually this dietitian was wonderful in that he was like, let's try and sort this for you. Let's try and work something out. So yeah, I am at some point going to be trying a dairy-free, lactose-free, everything-free feed, just to see if it makes a difference to my quality of life. So I am now 2.5 weeks post-op. I know I look pretty good, but I get about 2 hours free time a day, and by free time I mean time to reply to emails, to do things like this. Like, it's a lot, my current routine. So I'm nowhere near working again. I'm getting quite a few emails saying, oh, I saw you on social media, you're fine. And I'm like, no, like, social media is very different from how I actually am, and no, I can't do that thing for you right now. I'm filming this in my free time because I'm ever productive, but this is something I can take it or leave. Yesterday I was really poorly and I couldn't have done this, so it's kind of it's a balancing act, and I'm doing okay. Things are healing. The stoma is still pretty watery, so irony of ironies, I've had to be put on codeine to thicken my output, which I just think is pretty hilarious, given that, in a really sick way, given everything that's happened. Having a high output bag has been really eye-opening, in that I've had to learn a lot of tricks very, very quickly. So I have learned that if I'm wearing a dress and I'm changing my stoma bag, that I took that excess material in my bra, and then all the material is well out of the way of anything that I'm doing. The bag that we are changing, a stoma nurse in the hospital I was at suggested putting some essential oil in the bag just to make things smell nicer. Things like that I'm learning as I go. I still have quite a bit of surgical pain, which is to be expected, but bowel pain wise, my life has changed an awful lot. That sharp stabbing pain is no longer present, and that is a huge relief. And that's only 2.5 weeks post-op, so things are only going to get better. I've had to learn a lot about how to dress with my new stomas. Essentially for me, it's just wearing a dress constantly. Yeah, it's been a steep learning curve, but it's been one that I've been really happy to go on because I've been waiting so long. If you're still here, it's quite a long video. Thanks so much for watching. I'm going to be filming some more update style videos as we go, but I wanted to film this while it was still very fresh in my mind, sort of as a log of where I am now, and then in a few weeks or months I'll film again and we'll see. See you again sometime. Bye.